So we're going to continue our video on adenomyosis, and in this one we're going to talk about some of the treatment options available for this condition. Adenomyosis is much more difficult to treat than endometriosis because it generally is confined to the uterus, and any sort of surgery that we do will put the uterus at risk. Now, there are really two types of adenomyosis. There's diffuse adenomyosis, which is really spread diffusely, as the name suggests, all throughout the muscle of the uterus. And then there is sort of focal adenomyosis, which is formed in clusters in a certain location in the uterus, often in the form of a clump of cells, which then clump together to form a discrete mass called an adenomyoma. As with most treatments, we think about medical management and surgical management. When we talk about surgical management, diffuse adenomyosis is really hard to treat. There's almost no surgical management of adenomyosis that is diffuse in nature, short of a hysterectomy. So obviously, for people who have finished their families, who are in lots of pain and have really heavy periods, are iron deficient because of adenomyosis, then in people who are not desiring families, then hysterectomy is a possibility, and there's various ways of doing hysterectomy. Generally these days, if the uterus is generally relatively normal size, most of us will do a total laparoscopic hysterectomy. In those of us who have diffuse adenomyosis and who want fertility, then unfortunately there is no surgical option that doesn't involve removing the uterus. For adenomyosis that is focal in nature, that is, it forms an adenomyoma, you can try and remove the adenomyoma, sort of like removing a fibroid. The difference, and this is a key difference, is that fibroid surgery involves essentially a clear distinction between where the normal tissue ends and where the abnormal tissue begins. And this is essentially called a tissue plane, and once we get into that tissue plane, we can shell out the fibroid. That doesn't really happen with adenomyosis. It's really hard to distinguish where abnormal tissue ends and where normal tissue begins because it's such an infiltrative process. So you can't really just easily shell out an adenomyoma. It involves quite extensive surgery, and it also involves potential resection of a lot of normal uterus tissue in order to get the adenomyoma out. And in other places, especially in places like Japan and the States, they will do flaps and things like that to reconstruct the uterus after extensive adenomyosis surgery. In terms of medical management, adenomyosis can be managed medically, but it really can't be cured medically at this point in time. Like endometriosis, there is a degree of hormone sensitivity to this condition, and therefore hormone blocking medications, the things that we use for endometriosis, things like GnRH analogues, both agonists and antagonists, and also things like aromatase inhibitors such as letrozole, which block essentially estrogen formation on estrogen action. These can be trialed. Their efficacy does vary in nature. Heavy menstrual bleeding can be controlled using hormonal devices like Mirenas, so they are intrauterine devices. They can be controlled using things like the pill. I have to say the progesterone-only pill for me is preferential over the estrogen and progesterone pill, purely because some of the disease is estrogen sensitive and therefore can proliferate with estrogen. And medical management is only sort of a temporary control, but it's often the only option available for people who desire fertility-sparing treatment. Sometimes when adenomyoma is really close to the lining of the uterus, we can put a camera inside and scrape off some bits of that adenomyosis. But generally, it's a condition that's really hard to treat, especially in people who desire fertility. And often we focus on the fertility aspect in getting the family completed before potentially talking about more definitive non-fertility treatments like surgery. It's certainly an area that needs a lot more research. As I said, we know a little bit about it. We certainly don't know as much about it as we do with endometriosis. And it's an area ripe for research that we can actually get some real cures for people.